Viva Las Vegas. Viva Las Vegas for sure. My wife was very, very supportive. Just one night we were sitting having date night and she says, honey, find something you love to do and just go for it. I will support you, I will back you. And she suggested, John, you love to cook. Why don't you go find a cooking job? And sure enough, that's what I did. We found out that my wife had breast cancer. She had passed on Halloween. And then my daughter died 5 months later. On my birthday, she was coming to pick me up at work to take me out to dinner. And she was killed by a drunk driver who came off the freeway at 86 miles an hour. And she died instantaneously. Losing my daughter unexpectedly drove me over the edge. And that's when I became homeless. That's when I became a drug addict, an alcoholic, and I stayed that way. This was me. I was at rock bottom. I was literally in the gutter until one day, coming out of the mental institution, I met Clarence and I was given hope again.
When John and I met, John was in a dark place. He was in a dark place. Knock, knock.
Yes!
How are you doing?
I am so blessed.
Clarence, thank you so much.
Something in my heart, Clarence sparked. He gave me hope.
Your faith in me.
It's okay. It's okay. I assess our members and find out what their barriers are to their success, whether it be housing, just therapy, and try to help them overcome those barriers.
We pay for the options that are really helping them thrive in the community, to be able to have housing, transportation, obtaining licenses, phones and minutes.
I think the goal would be that when a member enters or contacts the healthcare system, that they're being treated as people and not as diagnoses or symptoms. Committed to serving our payers, which are the states, but at the same time we want to improve healthcare outcomes. So integrated care is part of that solution. Over time, costs stabilize and do go down.
You sit back and you're just so proud that you're able to make an impact on the lives. You know, it goes to show with John even, you know, he's chosen to give back to those members that are experiencing what he's experienced and provide for them as well.
He wants to be a counselor as well. He can use that to let them know, I've been where you are, and I made it through.
One thing I encourage every one of the gentlemen here is to say in the morning when you're brushing your teeth, I am worthy to be here. I am worthy to be loved.
It's all about caring. You're not just caring about the care that you give the individual, you're caring about the individual as well.
I want to give back what was so freely given to me. And that's a simple one word, hope. They gave that to me.